Welcome to After the Call, the podcast dedicated to the stories and struggles behind the badge, the turnout gear, and the uniform. Each week, we'll bring you a powerful conversations with first responders, mental health professionals, and advocates who are breaking the stigma, sharing their journeys, and offering real solutions. We'll talk about PTSD resilience, family impact, and the resources that can make a difference. Because the job doesn't just leave scars on the body, it affects the mind, the heart, and the people who serve alongside us. And no one should have to carry that burden alone. This is After the Call, where you'll find strength through resilience.
All right, thank you for joining us on another episode of After the Call. I'm your host, Patrick. We have Josh.
Tori.
The cohort. And we have Dr. Heather.
Cohort?
Hello.
Cohort?
Cohort?
It's a cohort.
I thought it was just the Fost.
Oh, Fost.
The fake co-host.
Yep. She's our technical person that does all the cool stuff.
And sometimes you let her have a microphone.
Yes.
Sometimes.
But, hey.
Just to insult you guys.
Can I finish?
Yes.
All right. So we have to give a quick shout out to Crisis Ready Nutrition. They are our sponsor today for this episode. So we're going to do that. So Chris from Crisis Ready Nutrition, thanks for sponsoring this episode. We appreciate all of your support and bringing me on as a brand ambassador.
You didn't introduce Heather.
I did.
You did?
If you want to be a brand ambassador, you got to flex these things.
Oh.
give a quick flex if you really want to embrace that brand, you know? It could do for you.
I'm not trying to tear the shirt right now.
Oh, I get it.
Yeah.
I understand.
It's my
We're
only
on a
one.
budget.
Yeah.
I wouldn't mind if you did tear that shirt, though, off.
I have to go.
Can we try to get back on track?
Yes, sir.
So today, I'm actually excited to talk to you about this stuff because you have a really cool concept with natural pediatrics, but the alternative medicine that you're doing within your shop is really cool. I was excited to go into your shop and kind of see what you're doing within it. I know I'm not a kid, but I got to experience, what you're doing for adults as well as kids.
Correct, yeah.
So we're going to dive a little bit into it.
Okay.
Talk about maybe the science behind some of this stuff.
Okay.
So people can understand it. And then wherever you want to take it, we'll take it.
Okay.
So do you want to give a little background on your experience so people know, like, your level of doctorhood?
Sure.
And your motivation.
Yeah.
Okay. Yeah. No, fair. So initially I was traditional Western medicine. I've always been in research. So even as an undergrad, I was always in someone's lab on any research project I could get into because I thought, I loved learning. If I could be a student my whole life, I absolutely would because it's fascinating to learn things. And of course, I'm a mom, so most of my schooling was done at night. And that's just kind of how I did it. And then I got 2 master's degrees, one from Northern Colorado and one from Johns Hopkins. Still, Johns Hopkins was more, again, kind of research-based, learning about GMOs, learning about I loved that school because it didn't tell me how to think. It brought me both sides, and I got to really learn how to read research articles and think clearly and critically of everything and question everything. So I really appreciated that education. While I was going to school, I met this amazing person that was like a sister to me, my best friend. And she also wanted to go to MD because we were both doing the pre-med route, both moms, both trying to kill each other at night, And she was a larger individual, and she never kind of felt good in her skin. She never felt attractive. She had been married before, but she was in an abusive relationship. And so she would bring her daughter over and we'd study OChem, we'd study all the things. And she decided she wanted to get gastric bypass because she really, really wanted to. Finally, she thought, I'm going to become a doctor. She'd gotten into UConn Medical School, and she thought this was my new opportunity to provide a better life for my family. And she shouldn't have never gotten the surgery. Mentally, she wasn't there. I mean, she still was planning on eating the same things that she had eaten before. It was just kind of like this Band-Aid fix. Well, now everything's going to be different, that I'll be skin. Mm-hmm. And so part of the criteria in order to get the surgery is you can lose weight for the whole year, but you can't gain weight back. If you gain weight back, then you can't have it. But during the last appointment, she had put on, I think it was at least 20 pounds. And so she was not supposed to get it. But of course, she cried and she was so upset. And so they let her have the surgery anyway. Well, she got, her blood pressure was super high upon exiting the hospital, but they still let her out anyway. She was saying that it was white coat syndrome. She just wanted to get out of here. That's why she was so agitated. Her blood pressure really, I mean, it was bad. And she is a Black individual, so she's more prone to clots. She's more prone to a lot of different things, but they let her go. She was supposed to take time off for about a week to rest and recoup, but she's a single mom, and so she went back to work 2 days after. And she ended up passing away 10 days later. From a blood clot. I was able to be with her during the last little bit of CPR. She was one of those vibrant people that I just expected her to come back and be like, haha, I'm back, you know, like with this great story, like you can never get rid of me. And so I kept anticipating that the entire time, and it just didn't happen.
That's not where I expected this conversation to go.
I know.
No, and I think
good.
that's great because obviously a lot of the stuff that we talk about is mental health and all the things that happen with suicide and losing people, and it's pretty rough, right? And I'm sorry for your loss.
Well, I mean, the good that came out of this, obviously, we lost a super good doctor and a best friend and a lot. But what I gained from that experience, I also adopted her daughter. So I got a little piece of her. I get to raise her sometimes, and I'm like, damn you, Faden, when she's bad. But it taught me that medicine, the way that I was looking at medicine and the way that Western medicine was looking at people, was looking at people in parts, in pieces. And mental health was never considered in that equation. And that is not how I wanted to practice medicine. I wanted to look at, and also like find out what's happening, not just like give someone a pill or something like that, get to the root cause of like, okay, so even when it came to her, like, why weren't we looking at like, okay, what is her thyroid doing? What is all of these other pieces doing? I mean, something's off here. But so the bright side is that's my motivation for all of this, is providing a better life for other people, something that my friend did not experience. And luckily now I'm actually finding like Hashimoto symptoms in 8-year-olds. I mean, but I'm able to help prevent chronic disease in families. And, you know, usually the whole family gets involved, and, you know, then we have generational impact, which is what I love. So that's kind of where I'm coming from.
No, I think it's great.
Yeah.
I think it's huge because, I mean, there's pills being thrown at people all the time, you know, like, hey, I have the symptom. Well, here, try this. It's just like, there's no research behind it, or there's no understanding what may have led to a certain something or other. I'm not a medical professional. But, you know, like, it's just, you go to a regular doctor, 15 minutes, they're throwing a script at you, and out the door you go, and it may work, it may not work, and then it may make things worse. You never know.
Yeah, they don't think about the root cause. I feel like as a first responder, like, obviously chronic stress is like the worst thing for your body. And I think a lot of us go in like, oh, I don't feel like, you know, myself. And they're like, here's a script. So I think it's super important to know the root cause, which is probably your chronic stress, but.
Yeah, there's a lot of things. Yep. Couple questions. So you said GMO. What is that?
Genetically modified foods and organisms. Okay. So I was studying the aqua bounty, the fish that they genetically engineered with chum salmon to make them grow faster, which was great because it would theoretically bring the price of salmon down, and you wouldn't have, you know, it's a controlled tank, so you're not having the aluminum in some of the, you know, where they harvest the fish. But there is some concern considering that IGF-1, which is a growth factor, is increased in those salmon. So obviously it couldn't be used for like sushi or things like that, because then that IGF-1 doesn't get denatured with high heat. So individuals that are more prone like pregnancy and cancer and things like that, they would never be able to have that. But then how do you regulate that? So there were a lot of stores like Whole Foods and places like that that refused to purchase it. Ultimately, that company I don't think exists anymore. But I was looking at the kind of the cost benefits of making omega-3s and making salmon and things like that more available to more populations, which is wonderful. I mean, because it's such a high dense nutrient food for families. But then again, like, you're weighing like potential costs. So
yeah, super important. I didn't start taking omega-3s until like 2 years ago.
Super good for the brain.
It is. Yeah. No. And then when you went to the different schools,
Yeah.
obviously you went to University of Colorado
Yeah.
and Johns Hopkins.
Yep.
Like, what was the, I guess, like stress level and academic level, compared to the two different schools?
Oh, yeah. So one was like a 1-year condensed master's program at University of Northern Colorado. And that one was rough just because it kind of mimicked medical school a little bit, because you are taking like 12 classes and you only have basically like 2 semesters to do everything in. And it was no joke. Like it was good in terms of load requirement and trying to get as much information, but it still was more like memorization and knowing the facts, where Johns Hopkins was a lot of information, but it was, their exams weren't even close to anything I've ever taken before. It's no multiple choice. It's basically like fill in the blank text box, but you literally have to pull and integrate every information that you have taken. So it's not like you can study the night before. Like you really have to know it in order to use it. And so that was huge. The stress level was crazy high because I did have to know every single thing. You couldn't just, lay back and passive study. You had to like get on it.
Could you define Western medicine for the listener in like how you see Western medicine versus the other modalities that you now also promote? Like, what is your personal definition of Western medicine?
Western medicine is more like, I would say, more reactive medicine.
Okay.
So it's basically you go in and then we'll give you something, but it doesn't look at like preventing most things. Like it does have checks in there. So you're supposed to get blood work done at this age and this to rule out this and this, but it's not actively checking in with you to try to prevent, and say, okay, well, this is a family history here. Like and mostly they do that more towards when you get as an older individual and they're like, hey, have you done your colonoscopy? Have you gotten your mammogram and things like that? But they don't tend to be more proactive, where I would say this modality tends to be more proactive. Most of my treatment plans for kids will be some type of diet related. Diet, activity,
Right, sure.
And if we need to throw, what I don't like too is sometimes with my profession, which I love, but we can also be green allopaths, where we're doing the same thing, but we're just using a different supplement. So it's not a prescription, but it's a supplement. For me, I lean heavy on it is a work of medicine. Like you do have to change your lifestyle to prevent things and be more active. This
is where I would tend to defend Western medicine and like everything that it has done is like, I blame a lot of what's going on with our medical on the individuals too, and the choices you make day to day. And we know as well as anybody else, trying to get a first responder to do anything preventative for themselves.
It'll never happen.
So
Yeah.
Western medicine, for everything it's accomplished, I would say over the last 100 years, the criticisms of it is, everyone only goes when they're broken. They demand perfection, and the other ones that aren't demanding perfection, they don't even want to do the work of a solution. They want the pill. They don't want to change their lifestyle.
You need to be proactive.
I think we've earned the type of Western medicine that we've gotten as Americans. Does that
fair.
make sense?
That's fair. Yeah.
I think most doctors, when you talk to them, they wish it could be better. Like they want to be helping in different ways as well, but it's become morphed by lawyers and insurance companies and just the average American not taking their health and diet seriously until they have to. If that makes sense in any way.
No, I totally get it. And and that's part of the problem though, is yes, insurances get in the way and they tell you how long you can spend and what you can do. And so it does
15 minutes,
bind.
yeah.
Yep. That is definitely part of the problem, because I do think then people do get trained on what to expect and then if they have no skin in the game and it's a free visit that they get every year, like, what does it matter?
Right.
And you don't care if you like your doctor. You don't care. I hated bringing my kids to well child checks just because I'm going to wait in that stupid, waiting room forever. We get a few minutes with the doc and like my kids hate it. It's a dumpster fire.
Right.
And so I stopped taking my kids to well child checks too, because I'm like, they're perfectly healthy and this is just a train wreck.
Mm-hmm.
So.
Sorry, my radio show is called The Dumpster Fire.
Oh, okay.
Sorry.
Gotcha. Gotcha.
Full circle. Sorry.
Full circle.
No,
in Wednesdays.
I 100% agree with that. When my kids were younger, I hated going to the doctor, because you sit in the room and your kid may be perfectly healthy, but every other kid there is like sniffling, got all these germs, and you're just like, get the fuck away from me.
Yeah.
Because I don't Yeah.
Well, and that's the thing too, though, is the difference with me is you go into the room with me and I stay with you the entire visit. So it's not like I leave the room for 20 minutes and like then your kid's like opening up all the cabinets and, you know, throwing shit around. Because my kids were like losing it. And I'm trying to like just keep them active from tearing up the office while we wait for them to come back and give me some printout or some shot or something that they need, that whatever. And then the breaking point for me was last time I took them to a Western med doctor. They wanted to push the COVID vaccine on, and I just had questions about it. And the doctor turned around and walked out and would not even talk to me after that. And so then I was like, okay, we're done here. If I can't even have a conversation and you tell me why this is necessary for my child, we have nothing to say here.
And they knew you were a doctor?
Huh?
They knew you were a doctor?
I wasn't a doctor at the time.
Oh, okay.
So yeah, it's been a hot minute.
All right. Was there something that occurred that changed you from Western medicine to naturopathic?
So
because there's got to be a point where you're just like, I'm going to switch.
Yeah. So I think it had to be, even when I went into school, a naturopathic medical school, I was still very like, open-minded, critical though of everything, no matter what it was, whether it was Eastern, Western, like I just thought, because you know, initially some of the courses were like, oh, you know, Western bad. And I'm thinking like, oh, no, the Western, not everything is bad. You know, like they've got good points. Like, you know, there's always good in every single thing, but there's not just one modality that will fit all. And, you know, so I was kind of hypercritical a little bit where I was like, you're kind of coming a little hard here. But I'm trying to remember exactly when it was that I think it was an immunology course. And we started actually talking about vaccines and we started talking about the immune system. And then I really went down the rabbit hole and I was like, okay, you know, this is better. And I was trying to figure out how the body worked. And I was like, you know what, this is more like root cause sort of things where it's not just the body and dysfunction. They're all connected. So we can't just, even though I'm learning the body in different parts, different systems, like that it is all connected and this bleeds into this. And so, yeah, I think that's really what kind of sparked more the naturopathic route.
All right. So I guess, no, I'm not going to ask it.
What?
No, I'm not going to ask it. We're good.
Why?
What?
Oh, we're good.
You have to ask it now.
Yeah, now we have to know.
No, seriously.
Patrick, expose yourself.
Wow. Okay, we got Shaylee here. I don't know if we want to.
Not like that.
We're trying to be professional. Okay, so COVID happened. All this stuff kind of changed for you.
Yes.
When did you open your practice?
In 2024. So, yep.
And what was your model when you set that up?
So I had exposure at another facility that was like mine, but not so much. I didn't like the way that they did things just because I felt like it was a money grab and not necessarily like doing how I want to practice. So okay. I changed a little things, but the model was a good model. The model was, you know, treating kids, keeping them all in the same room, and yeah. But they didn't see adults. I wanted to also see adults too. So I needed people that were good. My jam is kids. Like, I know I would say I'm pretty good at investigating children. So
you primarily deal with kids?
Me personally, I'm more of the kids doc. Like, if you've got really weird cases, I'm your gal. Okay. Like, because I'll find the zebras and usually I can figure things out. I'm not perfect, but like I have been able to solve some Mayo Clinic, you know, PCH cases that they couldn't do. So a little flex for myself there. But the other docs are super good at kids and adults. Like, I don't like hormones. That's not my jam. But, you know, you give me some weird rashes and some, you know, flu-like symptoms.
Tell us the story. What was one of your cases that was difficult to crack that you...
Yeah, I want to hear like the Mayo Clinic stuff.
Okay.
Flex.
Okay.
Give us
flex. All right.
Flex.
So,
Flex.
Yeah, this one I'm still working on. This is not complete because this was so crazy. But I first saw this child when I was at the other clinic, so it was like 2023, and he was coming in for incredible stomach pains, like would be doubled over in pain all the time.
Kidney stones.
Yeah, got to be the
I saw
kidney
I saw
stones.
the
Narrow urethra.
Exactly. Patrick's got this.
Patrick's on the case. He knows
I'm not
all
even a
about
doctor.
this.
I'm not even a doctor.
So,
Solved.
no. And so we did a food intolerance test, which is kind of standard to find out, because there's a difference between food allergy and food intolerance, which people mostly don't know. Two different antibodies.
One's
one is
histamine and one would be...
Well, yeah, they both have some histamine response, except one, so an allergy is an IgE antibody versus an intolerance is an IgG. IgG is more circulating. They kind of persist for a while, where an IgE that's quick on, quick off.
Okay.
IG can last for 60 days. There's an accumulation too. I usually say like an intolerance is like deep water. Like you really sometimes don't even know that you're intolerant to something. It doesn't really show up. It's kind of deep down. So it can manifest as like personality changes, constipation, rashes, things like that.
Always.
Constipation?
Yeah.
Yeah, okay.
I need Patrick helps me out with it.
Right now. I got the cure.
You're stupid. Anyways, I am intrigued.
Double flex. I've just solved 2 medical mysteries.
There we go. Yeah, really, you're on this. And so ran it, came back, and of course it lit up like a Christmas tree. So he had leaky gut syndrome. And so we kind
So this would be the
IgG, correct,
okay.
intolerance. He was intolerant to basically everything. Almost everything he ate was giving him a stomach ache because his stomach integrity was just gone.
How does this poor kid even get nutrients? Because if he's literally leaking, how the hell is that work?
Right, exactly. He was.
Stay tuned, Patrick.
Exactly. Dun,
I'm
dun,
asking
dun.
questions.
And so we did like blood work, and it came back he had celiac. And so he wasn't absorbing things, and his gut was shredded. And of course, also then he started experiencing psychiatric symptoms, to where he would hallucinate. He was chasing around people who couldn't sleep. I mean, the family took him up to PCH like 3 different times, and they would just give him some like anti-seizures, some pain, and some like calming medicine to just, keep him out of crisis. But they basically gave him some dumb diagnosis of like, we don't know what's happening. And I was like, okay, well, because he's not absorbing, check all these vitamins, have them while they were at PCH, because they can run all these labs, like run his, B1, but run all these different things to see like maybe that's part of it, because they were just like, I don't know, he doesn't have any infections right now, so we're not really sure. And so they came back deflated. And so I ran an ASO like for pandas, and it didn't show up initially. And so we were like, okay, what else could it be then? So we gave him high amounts of vitamins, and we tried to do a lot of probiotics because I wanted to rebuild his gut. So we're trying to do all the different things, and he's really his diet was super narrow because I had to heal the gut. You have to remove everything that's offensive. He basically lived off of 10 things, and he had these like Kate Farm shakes that he was eating, but it still wasn't getting better. And so then I found out too that one of those shakes had rosemary extract, and if you don't know, rosemary is a powerful antimicrobial. And so he was so sensitive to even the littlest would kill everything that we had just built up with his gut microbiome.
See, that's the most fascinating thing, is how much your microbiome affects almost everything.
It's your second brain.
If you get me talking, these guys have all heard, like, I don't believe in free will. Like, not at all. I feel like almost everything you're always doing is being pushed in some way by factors you can't control. Now you're coming in here, you're talking about a kid whose behavior is changing. The next decision or behavior he's going to do is being massively influenced by his lack of bacteria in his gut. It's mind-boggling. It's mind-boggling how much a proper diet and having
don't buy
everything.
into his bullshit though. He drives a taxi cab.
I do.
What? Oh, the ambulance?
Yeah, the conspiracy theories. Are you kidding me? You've never seen the people that... No? Okay. No, Josh has got good points sometimes, but sometimes he'll go off the rail.
You know what? I'll put my tinfoil hat on with you.
Thank you.
Yeah.
Thank you.
And that's the end of our show. No, I that's crazy. It's crazy to think that these little ingredients that most people wouldn't even worry about is literally just killing this kid.
Yeah.
Essentially.
Yeah. So, I mean, now he's doing better, and we don't have any more of the psychiatric episodes, and now he's able to, every time his gut gets his behavior improves. He stops seeing people like it's. I mean, it is his microbiome, neurotransmitters, like all of that stuff. So we're still working to heal because it's hard with celiac kids, but that's one of the things that I've noticed too is they also have the propensity to develop strep infections and have a hard time fighting those strep infections. And so subsequently we did test and his titers were off the charts. So it was a PANS-PANDAS diagnosis. So we're working still on that, but greatly improved. So,
cool.
But yeah, it was like, okay,
I know.
I got this, so, but it wasn't through a lack of trying. I mean, I studied that case all the time. There's cases on my whiteboard in the back room that we go over all the time that are troubling, but we look at every single avenue because, I mean, you're right. Like medicine is not perfection, right? And sometimes people do expect perfection. I had one person that got mad at me and they're like, yeah, you misdiagnosed this rash. And I was like, okay, it changed over 3 days. But, I'm still having you come in. We're still doing the work. But they were mad that it wasn't this instant perfect diagnosis.
Was it you?
It was me.
Tori.
I know. They don't allow me back now, but
Yeah,
whatever.
it's fine.
Do you still have the rash?
Yeah. It was misdiagnosed.
Jesus. All right. No, it's wild. You can't please everybody.
True.
I mean, whatever. Yeah, we had to deal with that a lot in the first responder world.
Only a little bit. Only a little bit.
Only slightly.
Every person was like, whatever. Okay, so now with the whiteboard, are you pulling like the whole house?
Yes.
Like methodology where you're like,
yes. No,
all the
we
different
have
stuff?
flow charts. I like to refer myself as like the naturopathic house, but then I'm like, is that too hard of a flex? 'Cause
No,
like
it's
I was
not.
like,
I bet you so. I bet you so.
But we do that. I mean there are cases that we just can't, that we're just keep trying to crack, and usually by the end we're somewhere close. But there's usually huge amounts of improvement. But yeah, it's still not perfect. I wish it was. But
what's the biggest type of cases that you're seeing right now?
I mean, we always see constipation, eczema, are like ADHD, autism. Those are kind of like our bread and butter. I don't know. We see a lot more of kind of everything is all about the way that we eat and the way our food is processed. So I see so much inflammation in kiddos that shouldn't be there. And so, yeah.
That stresses me out. What can we eat? It's like every day.
Yeah, but like, I mean, you look back to what we used to eat, as kids, and it was whole foods. I mean, you'd come home and there was a starch and a protein and a vegetable, and now, I mean, it's survival. It's hard to say because we're all surviving families. I mean, I'm not perfect. We eat out, but we do our best, and so we try to make better choices when we can, but it's hard. I
mean, even portions sizes have changed since I was a kid.
Absolutely.
I mean, I was where people were like supersizing everything.
Yeah.
Right.
Well, and part of this comes under in today's day and age, you're more likely to die from overeating than undereating for the first time in human history. Right. You're more likely to die from old age than young age for the first time in human history. Like, all of this is coming on the back of like a lot of major improvements for humanity over the last 200 years. But I completely agree that somewhere in the last 50 or so, it's gone awry. It's become more business and profit. It's been incentivized in the worst possible way. And those poor incentives have caused, frankly, a lack of true professionalism and really putting patients first before profit. Like it's the pharmaceutical I transport people all the time. We once had an idea to try to show just how bad Western medicine and insurance companies have gone by having an individual dial 911 at a California beach and then getting free transports in an ambulance across the nation and ending in Staten Island, California. Just taking an ambulance transport without giving you my name, just telling you my belly hurts, and then asking to go to a hospital. It's about an hour away, which is where most people will transport you, about an hour away before they ask too many questions. And you can do that and just not pay a single dime, but just be transported to hospitals and then just walk out AMA, never seeing a doctor. Totally okay. And just
So I just don't have to give my name?
nope, don't give your name or nothing.
I
You
get
just
free medical?
ask for transport.
You might get a little bit of fentanyl.
Badass.
Might get a little fentanyl.
I'm
You get-
allergic to everything but the one
And
that
you
starts
get
with
to
an
hang
F.
out. You get to hang out with your heroes, a bunch of firemen,
That's
for a little
true.
while.
That's
Love firemen.
Yeah.
I'm so excited. Oh my God. That's amazing.
That's
All right.
crazy.
So let's dive into your practice now.
Yeah.
So when I came in, first thing you obviously walked me around
Yeah.
the shop and stuff like that. But the thing that really intrigued me was your salt room.
Yeah.
Mm-hmm.
And I thought it was pretty amazing. And it wasn't what I expected, even though both you guys told me it's a salt room.
It's a room of salt.
But there was salt everywhere.
Yeah, no, I walk in, I was like, is this for real? Like, all right, yeah. So kind of talk about the methodology behind what that does, what you're doing with the circulating of the air and all that other stuff.
Yeah. So basically, I had this idea when I was working at another practice where we were sending kids to the hospital for like nebulizer treatments and things like that. And I mean, trying to get a kid to sit still who doesn't feel very well, who has a fever, and trying to put a mask on their face or get them to breathe in, it's so difficult. And of course, when they're fighting it, then, how much of the treatment is actually, happening. So the whole idea was using the salt room. So basically salt air. So it's basically, it's not saline, but it's salt air that they get to breathe in while they relax and play. So there's salt all over the floor, and I want their feet to touch it so that they can absorb some of it. And then it's the halo generator particleizes the salt, puts it in the air. So you're basically just breathing it in and relaxing. Even if you sit in there for like 5 or 10 minutes, we sat in there. You can just, you can like it opens up your airways, and it also, so water follows salt, so it's going to thin any of that mucus that you have so that you can then go ahead and cough it up. It's antimicrobial, so antiviral, like all of the good things. So it kills things. You can breathe better. Even for my asthmatics, it helps a lot too, thin some of that mucus. And it's usually a 20-minute session. But the beauty, what I love too, is this isn't a spa. This isn't somewhere. This is where your kids can, there's Duplos in there, there's toys. They can throw it around, like you're not having to like hurdle and round up your kid. There's a seat for you to sit there and relax so that you can enjoy it. And your kids, you don't have to sit there and babysit them. You can just sit there and they're going to play and have fun. And so it's like a play date where they get treatment, where they feel better. So
you could go together.
There you
Just
go.
play in the salt.
Just
Have salt
play in the
fights.
Yeah.
I sat in there with my toes in the salt.
Oh.
I did. I legit.
Yeah, I think it's the coolest part of it.
Yeah, I felt like a little kid with my feet swinging. Like it was
You
cool.
did?
I did.
Did you play with the toys too, or?
No.
They didn't give those
I
to you?
was trying to be professional.
Oh, for sure. For sure.
Second visit.
Second visit.
Yeah.
Yeah,
They now know Patrick.
It's a good thing you didn't have crayons in the room.
He would have eaten them. He's like, I love the red one.
I'm gonna drink my coffee.
So what?
The other thing too. So going to this, even if you're healthy,
Yes.
going in there is still beneficial because
Correct.
you're still increasing your lung capacity.
Correct.
You're still getting rid of bacteria, germs, or whatever because there's stuff on you that you don't even know about that your
Correct.
body may not be affected by, but it's
Sure.
good not to bring it home, do all
Yeah.
the other stuff. So tons of good benefits.
Yes, absolutely.
What are some of the short-term benefits that you can notice going into a salt room, and what are some of the long-term benefits of regularly being?
Well, I think just kind of what he said in terms of like increasing lung capacity, and I mean short-term benefits. Sometimes one of the negatives is though your nose runs because like it does thin out stuff. But usually, yeah, you can breathe deeper, and I think it also helps you notice your breathing too in terms of long-term of like, oh, I've just been kind of taking more shallow breaths. I need to maybe work on that. But yeah, in terms of like immune system, it's super, super helpful for that very instance that it is helping kill things that you're not even aware of that you've been breathing in, or help at least when it thins out mucus, then you can clear your throat and get some of that trash that's maybe been sitting there for quite a while.
Well, Arizona's air quality sucks.
Yeah, it's not great.
Then leave.
No, you're here.
Yeah. Nobody would
leave
cuddle
you.
with you.
That's true. That would be weird.
You want to get a vacation house?
I don't know how that would work.
What, a long-term relationship, like a long
We
distance
could
relationship?
we could FaceTime in the salt room.
I mean, I have no problem with that. But then who's going to lick the salt off your
no,
toes?
that's true.
There we go.
Yeah.
presents another problem.
Problems.
Yeah,
Real
problems.
world problems.
You can do it. You can do it.
Oh.
Wow.
Anyway.
All right. What else you got that's going on in the shop?
Yeah, I mean, so I guess my biggest thing for the practice is I'm parents' choice. So I am here to support the parents. You
Good.
know your child best. Like as much as I love your kids and as often as I see them, I still don't know them, and you know them best. So when you say something's off, then I'm going to believe you. And we're going, if you want a test run, let's run it. Like, I hate, because I know the feeling as a parent when your concerns are dismissed immediately, like, oh, well, that just doesn't sound right. And it's like, well, this is how they were acting before. Now they're not. So something is wrong. And so, again, when it comes to like treatment plans, I'm going to give you super crunchy all the way to Western medicine, and I'll support you either way. I'll give you the benefits of like, okay, this is this, or this, but I'll give you more education behind it. And then you ultimately make the choice. So that's something that I'm super proud of. And that also comes with vaccines too. So I do carry vaccines. I don't carry all of them. I'm not a huge fan of the CDC schedule. I don't think it's great for the individual. It might be great for the herd, but not great for the individual, especially when we don't know methylation status, height, growth, weight, like what's going on with their immune system, clearance levels. Like there's a whole lot that goes into it. And so I make individual plans based on exposure and, travel plans and like family dynamics, all of those things, which, I don't know that that's normalized. And but I will see your kid if you want to do 0 vaccines, all vaccines. I won't carry all of them. So there's some that you'll have to go to the health department for or somewhere else. But
choices are good.
Yeah, exactly. So, and then again, I carry the cleanest ones, and I'll talk to you about each one of them, why we give them, what for, and if there's a good time to delay it, or when would be the best time for this, and kind of just you can ask me anything, and whatever I know, I will tell you. But I like to have open dialogue with parents because that was one thing that was missing when I was taking my kiddos.
Yeah.
So
if I can ask this, what would you say is the must-have vaccines for
I was going to ask the same question.
Because when you look at that schedule now, like I don't even know what half that shit
There's
is.
like 20 of them.
Yeah.
Yeah.
And you're like, I don't even know. Like, it's crazy.
Right. So disclaimer, any decision about vaccine should be made between you and your doctor. Recommendations, correct. So during the first year, there's only 3 that I typically think are important to have. And those are the ones that I see could put your kiddo in the hospital during the first year. So those are ones that I recommend. But again, we can go over. So Hib is against Haemophilus influenza, which is a bacteria. It's a rough bacteria. It really is. And your kid can get it and they can get over it, but it might take about 3 weeks. It can cause neonatal meningitis, and that's why it was given early on. Usually that shot is pretty clean, so there's not a ton of risk with that one. But I still like, if we're not going to daycare, to delay vaccines until 6 months to make sure that gut, because the gut is your immune system. So I don't see the need in giving a newborn anything yet. Like let's get everything going first before we start messing with the kid. That next one is the pneumococcal vaccine. So that's against 20 different species of pneumococcal bacteria. That's everywhere. It's ubiquitous. Your kiddo is 100% going to get it. And even if you get the vaccine, I'm still going to get it on swabs when you're sick. So but it's one of the things that when I started seeing RSV, or I started seeing kids that needed to go to the hospital, when I swabbed them, it wasn't because they had 1 or 2 things. It's because they had 4 or 5. They had 3 bacteria and 2 viruses, and it just overwhelmed their immune system. Okay. So the reason why I liked that one is because it took off some of the bacteria off of that so that they could fight these other things easier. So I like that one. Does contain a little bit of aluminum. And then the DTaP I like for the pertussis aspect. That one, again, it's a rough bacteria, Bordetella, but your kid can get over it too. Many kids do. Again, it'll take a couple of weeks, and sometimes they have a pretty nasty cough. It's rough, but we do have other treatment options. But I like to get that one on board. And the lifespan of that one is usually 10 years. So we can play around with doses and how many times and things, but I only recommend getting, and this is me personally, so this is just my office, we only give 1 vaccine at a time, and usually 6 weeks apart. just because if I'm going to give one, I want to make sure that we're building antibodies to it.
Sure.
And that's kind of one of my biggest critiques of the CDC schedule too, is you're giving a kid 7 different vaccines at once and asking them to make antibodies to it, and then 2 months later asking them, and that's why they keep boosting and boosting and boosting, because they don't know if you've made antibodies. So we're just going to just go ahead and keep boosting and boosting. So I just don't see.
I don't even want to talk about boosters because I got a dummy friend. So no, you don't know. But we'll just
fake.
No. He's a real person. So he was one of these guys where during COVID, him and I disagreed a lot,
Yeah.
right? And he was a medic, and he thought he knew everything, and I'm like, this doesn't make sense. Like, you can't go to believing this shit after 5 days of like testing. Like, there's no fucking way. There's no labs. There's nothing that gives you the substantial information to warrant what you're saying. So he was like, did all the vaccines. I think he did like 5 of the boosters. Mm-hmm. And every time he would do the booster, he gets sicker and sick. I'm like, why are you doing this to yourself? Like, it just does not make sense to me. It doesn't make any sense. If it's not helping you, then why do it? So maybe you can explain that, because I don't get it.
Yeah, I mean, so some of the boosts I think are unnecessary.
Is it literally just a pharmaceutical thing? Like, we're just doing it for money? And I don't want to put you in a weird position, because obviously you have a professional.
Right. So
I don't want her to get murdered.
Right. Yeah, exactly.
I'm sorry.
Death threats. I know, because even when I posted a mental health on measles, because it was basically like, listen, because I had families call me and they're like, we're not leaving our house because of the measles outbreak, and I was like, nope, we're not going back to COVID times, because I had kids who refused to take off their masks because they thought that they would die. Like, that is the level of anxiety, and mental health is huge for me. So I'm like, we're not going back to that. And so I recorded a video that was just like, hey, everybody, like, they're really over, this dramatizing this outbreak, and it was like one person, and it didn't give any more information. And so I was just kind of trying to be lighthearted, like, you can go outside. Like, of course, we're still going to be hygienic and things like that. Not saying that prevented measles, but it's always good to do. And just like, but if your kid gets it, like, we can get through this. This is not like, because they were making it sound like a death sentence and scaring families. And I just didn't want to return back to that. So I got a lot of hate for that. So I might get hate for this, but it's fine. The thing that I don't like about it is there is no cap on these mandated vaccines in terms of cost. Every year when I order vaccines, the price on it goes up, which I like. That to me is money. I mean, it costs like $7 to make, and the pneumococcal shot that I buy is $315 per vaccine. So it's a lot. God, so
I'm in the wrong business.
I know, I am too. So I do think vaccines are helpful. I think that they can be very, very important. And I mean, like, I still believe in the polio vaccine, even though it's less than, a chance that you'd get it. That one I can't fix. Like, if there was paralyzation, I can't fix that. Most of the other ones we can, you roll the die, you get sick. But so I don't know who created this schedule, but it's a terrible schedule. It really is. It's just the 5 doses. I don't know where they got that. So some of the research articles that they post on the CDC website, I look at some of the research, and it's crap research. Yeah, he's getting cozy up in here. But like, I don't agree with some of the research studies that they've posted. Like, usually if I have a question, I actually will email a researcher outside of the U.S. Like, I have an immunologist out of the Netherlands that I consult, especially about measles, because the last thing I want to do is spread misinformation.
Sure.
So, but I want to make sure, like, okay, in this study, you did this. Tell me more about your methods, because I'm hypercritical of any research article. So I don't know how to say that. I don't know that this schedule, I don't know, sorry, that's not a great answer.
I think you just said the magical phrase, though, is that we're skeptical of all the research.
Yeah.
It's like, there's so much to understand, like, who paid for the research and what are their goals.
The fact that she has to talk to somebody outside of our country.
Like, I think what everybody wants is just to be able to trust the information they're getting again, right? Like, in some way, like, in the 90s and the early 2000s, when you would get something from some source, you more or less felt like you could trust it. And now we're at a state where it's like, I just don't know
AI
what.
generated.
You know?
Sure. But I mean, NIH funding too is you have to fund what, they will only fund what they want to fund. They're not going to like fund, if it's controversial or something like that, they're not going to give you money for that. So then how are you supposed to study, if you put, I want to study adverse effects of this, they're not going to give you money for that. So that's why you have to actually go outside of the U.S. to get studies that appear to be more non-biased, if that makes sense.
No, makes perfect sense. Makes perfect sense. Does the growing antibiotic resistance scare you as much as it scares me?
So not for me personally, because I don't use ever. If I'm going to use antibiotics, I'm going to use an herbal too. So herbals are great because they usually use more than one method of action. So, I mean, I created a herpes formula, actually. It's in clinical trials right now. But because,
you need it.
More flexing. No, we didn't talk because I had
If
herpes.
he has it, so do you.
I would love to go the next level, Patrick.
No. She
You're
literally
test
dropped this
subjects.
bomb on me when we were sitting in the salt room, and she's like, "I did this research." I was like, "What the fuck?" Like,
Well, it's perfect for you.
I don't have herpes.
Oh,
Rash,
gosh.
Yes.
rash girl.
Yes.
He's like, right now, I'm fine.
That he knows of.
After this
She's
weekend,
gonna cure
it. But yeah, and so I mean, some of our herbs that I found when we extract different the herb at different percentiles will have different effects, and so I've been able to see it on a firsthand level of extracellular and intracellular inhibiting viral replication, and that's the same way with some of our bacteria too. It's not just it's attacking the cell wall membrane, we're able to hit it from multiple sides, so then I don't have any lingering bacteria that are going to go ahead and become resistant. But I mean, I can't even use straight amoxicillin anymore for any of my kids, and I would never recommend just giving amoxicillin anyway. I see lots of kids who transfer over and it just doesn't work anymore, and it's only effective usually with gram-positive bacteria. And most of our infections aren't just strep and strep, which is gram-positive. It has a whole bunch of other ones. So I never just assume that it's all gram-positive. I'm like, let's go broad spectrum. We're going to add this and this and this to make sure that we got it all. And then, of course, you need probiotics because you just killed your gut. So we're going to have to, that's a missing step in a lot of these treatment plans that I get from other docs is no probiotics. So we're just going to kill off, and then we're going to let opportunistic bacteria recolonize the gut. And then that's when you get the bloating and you get the, inflammation in the gut. And
Red Hot Cheetos, all of a
there
sudden.
we
Start
go.
eating that.
Yeah,
and,
diarrhea. So, yeah.
Is it red hot? No,
Are
it's
you
flaming
learning a
hot.
lot right now, Patrick?
I don't know. I'm still thinking about herpes. Just kidding. No, because when my son was born, he kept getting ear infections, and they were throwing antibiotics like crazy. And finally, I was like, I got to find an alternative to this. I went to chiropractor.
Yeah.
It actually worked.
Yeah, I mean, sometimes it's a structural issue, and that's the thing is, and I love working with, I mean, again, like, even with my own medicine, one modality is not going to, like, solve everything. Like, I like to use homeopathy, I love to do herbals. I don't do physical medicine, but I have great relationships with chiros because structural integrity is huge.
Yep.
And, when things aren't matching up and align, like,
Because he had tubes twice.
Yeah, but
that's the
that's
thing.
a Band-Aid.
We didn't know. We didn't know.
Sure.
Because everybody's
absolutely.
like, well, you got to do this, you got to do that. I'm like, just fix my kid. Like, he's miserable.
Right.
And then once I realized that, I was like, oh, there's other stuff.
Yeah.
It's kind of cool. Cool. So with the salt room,
Yes.
who do you recommend to go in there? Like, can first responders go in there? Because obviously we are first responder.
What? Yeah, I mean, anybody can go in there, especially, I mean, it is for everybody. It's better when you're sick or not feeling your best because you can really tell the difference. But even if you wanted to go in there, especially after you've had a long day, it will help you breathe and relax, and you can kind of let down.
And people can just call and set up an appointment.
Yeah, you can go online. You can go online and book a salt room visit, or you can call.
How big is it? How many people can sit
Enough for
comfortably?
2 full-sized men?
I mean,
I mean,
no,
that's
it has a
bigger than this
a
room.
bench.
I mean, the
Yeah,
more
it's
men, the
slightly-
merrier.
It's
We would
You can fit more people in there, is what I'm
be
saying.
fine. We got this.
okay. Yeah. No, I mean, it's a little
The
bit
bench is
bigger
a little big.
than this room. But
pretty
it's it's comfortably 4 to 6 people
Perfect.
is what I recommend, because usually
We
Kiddos
could
can
literally
come in.
lay on the salt.
We should have recorded from in there. We
could-
should have recorded a podcast in the salt room.
We could
Badass.
we could make sugar cookies.
Like,
No.
Do you know what that is?
No, I don't.
I don't either. I
You've
thought he
never
was
been to the
talking literal
beach?
cookies.
I've been to the beach. Who
You never
hasn't
rolled
been
in
to
it?
the
You've
beach?
never rolled in the sand? That's a
Sure.
sugar cookie.
Oh, okay.
Oh,
I thought it was dirty. Like the way
yeah.
you guys talk, everything. I'm like, I don't know. This
See,
might be.
We're
some,
professionals.
Like... Oh, I forgot.
What I deal with.
my grandma called them snickerdoodles. Same thing. Rolling around the sand.
I didn't roll in the sand because that made me.
I don't think when
Yeah.
I was with your grandma that we called it.
And there it is.
Grandma Snickerdoodle.
Again, man. Leave my grandmother alone.
I apologize. So, so give us where we can find you, phone number, website, all that stuff. Because we're gonna add you to our website.
Okay.
Tori is actually.
Very nice.
I
so
know a
that
girl
way-
that has their logos.
So all that stuff will be added so
Who
that
is
people
that?
can schedule book times with you.
Yeah.
And then whatever information you want to add to it. So whether it's your supplement, like if you have certain supplements that you recommend for health, immunity, that kind of stuff, we can add all that stuff on there.
Okay, perfect. Yeah. And so I've been thinking about the whole like first responders, veterans. So I think we talked about doing $50 off the new patient visit if you're a first responder or a veteran. And if you're already a patient and you didn't get that discount, we can apply that later on.
Oh,
so I was going to do the hard thing is like I try to make my prices very reasonable for families. So I've never raised my prices. So they're pretty low for like just you have a new patient fee and then after that it's just the standard fee. And I don't want to raise it, but I don't really want to discount it either just because it's so low. But I have started Faithful Fridays. So I know you and I had talked about that. So basically it's part of the other issue that I have is usually my medicine is only for people that can afford it. And most of the people that need it aren't people that can afford it, right? And so I don't want to leave the less fortunate in the dust. So if you have access, once a week we will open up. Every doctor in my clinic will have a spot for Faithful Friday where it's $50. And that's a new patient. That's every visit, sick visit, follow-up, whatever it is, so that we can expand our care to those who cannot afford it.
That's pretty cool.
So
That's really won't see that in a doctor's office these days.
No, I mean, and that's the thing is if you're going to a naturopath, you are spending a little bit more, but you're paying for the quality of service. You're not paying for
They
the
spend
15-minute
a lot of time with you
Right.
versus like, you're just a number.
I mean, are you though? Because look, as a family of 4, I spend $330 a check, and we never go to the doctor.
Same.
So like,
No,
I'm
no,
spending
no,
a lot of
And
money.
that's really good. That's like
You know,
government benefits.
yeah, that's
that's
like-
great.
So let me
you know.
let me throw this at you.
Sure.
So when I was retiring and I was at my like worst time, right? I was trying to figure out what was wrong with me, right? I went to the regular doctor and they gave me SRIs. They gave me all kinds of just pills. I was like, this is not working. So then
Right.
I went to a naturopath and I was like, I can't sleep. I can't do this. I can't do whatever. And that's when we started breaking down the different hormones, aminos, like everything that you can, adrenals, like everything that you could think of. Like we're going to break down everything and work at it to fix what the problem is and not just throw a Band-Aid at it.
Right.
I understand that your kids and you may not be going to the doctor, but at some point you may have to.
No, right.
You don't want to go to a 15-minute
No.
consultation.
No,
you want to be able to sit
I
with
just
your
mean
doctor
that
and do stuff.
there's a lot of money that people spend
To not go to
toward
the
Western
doctor.
medicine to not go to the doctor if you're a reasonably healthy person. You know
Sure.
what I mean? Like, I get nothing out of it.
Yeah, we
I
spend
always
$600, but then it covers.
But that's what insurance
other people's
is.
diabetes
We still
treatments.
have our-
This is
Yeah,
what it
yeah,
ends up
yeah,
being. You
yeah,
know, we end up covering diabetes for everybody else on the network. You know.
But that's what insurance is. It's
Right.
for
Yeah.
incidentals.
Sure.
So
All right, I'm sorry. Go ahead.
It's the world's biggest scam to me.
Jesus
but-
I
Christ,
agree.
guy.
I agree.
Look, man.
I'm going to take away your cab. No more cabs. No more driving a cab.
Look, I work on a boo-boo bus. It's basically a cab for.
Well, that's true. That is true. But that's a totally different problem. All right.
Anyway,
Yeah, so give a plug to your stuff.
She just did.
do it again.
No. No,
like how to get a hold
yeah,
of her?
like how-
yeah.
yeah.
So if you go to naturalpediatrics.com, we have
There you
two
go.
locations. We've got a Scottsdale location, which is right behind the hospital
Osborne.
on Shea. And then our main flagship is in Queen Creek off of Ocotillo, or not Ocotillo, it's off of Ellsworth. And it's right near the Costco. So
Ellsworth and Queen Creek.
yeah, so super easy to get to. We have some Saturday appointments available. We do have some after hours because we do also know that parents work and it's hard to get time off. So
Sure.
It's awesome. Cool.
Cool.
Anything else you want to add to the craziness?
I don't think so.
All right. Well, I appreciate you coming out.
Thanks for
having me on.
Thanks for putting up with them.
I apologize for
Patrick.
me. Yeah.
It's just
I'll
Patrick.
get you that herpes breast.
My wife watches this. Like,
She knows you.
yeah, she does. I don't have herpes.
Well,
For
she's probably just like, man, put me
like,
on the list
"God
for the
damn."
medication.
Exactly.
He hangs out with Josh all the time.
Yeah.
if I have herpes, it's because of Josh. Straight up. That's the only reason I would have herpes. Thanks.
For what?
Herpes.
Herpes? Well, I didn't give it
It's
to
the
you
gift
yet.
that keepps on giving.
Yeah,
okay?
literally.
You know.
You have to be willing to go to the next level if you want to risk.
Oh my God.
All right, I have to go now. I'm done.